It's going to be an interesting conversation.
So I actually wasn't
Pro-vax
fully
against
vaccinated.
anti-vax.
Interestingly, I grew up with two parents that were into alternative medicine. So I was not vaccinated as a child, but as I got older, I vaccinated myself.
Well, I was vaccinated as a child, but my last vaccine was about 15 years ago when I returned to college, and I had a severe reaction in that I became arthritic in my hands, went to many, many doctors, and nobody knew what was going on and why it was happening, and just shrugged like, it doesn't make sense. You're too young to have arthritis. And it wasn't until having kids and sort of digging into my own research for them that a lot of answers started coming up, and I think it's unfortunate that a lot of it is overlooked.
Well, that's
for me, and I'll continue to get vaccinated regardless of the risks, because I've seen too many things on the other side. I've seen kids, come into the ICU and die from getting the flu. I've always felt like the risks are far outweighed by the benefits of getting the protection.
Stick up in. Me personally, when I was younger, I've gotten all my vaccination from since basic school, since primary school, because they used to come back in the 90s. They used to come to the school and vaccinate kids during school hours. So we used to have a spot. I don't remember which hand, one of them, but it's there. But I've gotten all my shots. I was afraid of vaccination, and my parents was never against vaccination. Then, and as I grew older, I'm vaccinated too with the COVID. Not because this was my personal choice. I didn't get the whole. I got 2 shots. I didn't get the whole 4. But I'll go deeper in that later on in the video. But for now, I'm just saying I've taken all my vaccination. But I am anti-drugs, as in not drugs as in illegal. I mean pharmaceutical drugs. I'm anti-pharmaceutical drug because pharmaceutical drugs affect everyone different. So sometimes I'll hear people say, "Oh, it's not good for you because this happened to me," but that's to you. Everybody body reacts different to something. Like some people can drink milk, some can't. Like me, I'm not supposed to drink milk because it upset me. So everybody, and there's millions of people that can drink milk, but there's a few people that can't drink milk, and there are a few people that can ingest, like for instance, flour or smoking. So some people can smoke all day long and nothing about it. And if one person smoke, they get ill. Like me, if I smell cigarette, my tonsils get swollen. So I've never smoked a day in my life. Well, no, that's not correct. I did smoke a Cuban once, but I don't smoke cigarette in general or weed or whatever. Cause it affects me literally, instantly too. So to continue.
Not getting vaccinated endangers other people.
No, it doesn't. It doesn't endanger nobody.
I will acknowledge
that was a scare tactic.
I know vaccines work. I know they give you protection. They vary greatly in what that protection is. It's not like 100% magical shield over you completely. But I do acknowledge there are some vaccines like the measles vaccine and the chickenpox vaccine that honestly, if you don't get those vaccines, you do risk catching the disease and passing it to others.
It's such a complicated topic, vaccines, and you're starting to get micro with each individual vaccine. And definitely the question was talking about the big picture, and I think, if you get micro, probably some of these vaccines.
I think when you're giving kids medication, you have to get micro about it. I don't think
it's not kids alone, it's everybody. Whenever getting medication, you have to be careful.
Just say,
people have allergies to a lot of stuff.
They're all safe and healthy and good.
Stick up in. I agree with that statement. Getting vaccinated is not the issue. The issue is what you're allergic to or what you're like me, I'm a healthy person. I eat right, I don't eat junk, I exercise as well. So for me, I'll be a prime person to take the vaccination without having any reservation. Because when I took my vaccine for the COVID, I had no reservation because I know my body can manage it. But you have others who have underlying issue. I'm talking about in general. I'm talking about just COVID. I'm talking about vaccines in general, pills, from all the pills, whatever it are, cough syrups or whatever. I'm talking about everything. This is a general statement. I'm just for some reason, whenever I take medications, I get 90% of the time I get the side effects. That's my reason for not liking medication. I rather use old school remedy like bush. My father is very good at he's very knowledgeable about natural medication. So that's what I grew up doing. Cause he know I have allergies when it comes on to most medications. I don't even take Advil. Not even if I have a headache, I would rather go sleep than take Advil because it does affect me after. So this is about how it affects you. Everyone should know how they feel when they take medication. Not everybody. Some people it makes them feel better. They feel well. They go about the day. Some people can't do without it. They go about the day. So it's a personal choice. So if someone want to take vaccine, it's on them. And if someone don't want to take it, you can't force it on them. It's that simple.
For you, that everybody's benefiting from it, because that's false. It's
But we
not
study
true.
them before we release them to the public. We study them, so we do know they're safe.
Well, not care how you study them, it still affects people differently.
It's
safer.
Safer, yeah.
Being in intensive effects is
Safer.
the worst of the worst. And so seeing the other side of kids who don't get vaccinated, I saw a kid walking in with meningococcemia, which I haven't seen in decades. He had all 4 limbs cut off. They had to be amputated because it was all dead tissue. You forget how bad things were before we had vaccines.
I didn't step forward for that because I don't like the assumption that if a child is unvaccinated, somehow they are of risk to everyone. And also knowing that vaccinated individuals can also be carrying and spreading diseases. I think it's very polarizing to separate the two as if you're vaccinated, you're totally fine. You're not risking anybody anything. Unvaccinated children don't just have diseases hanging out in their bodies waiting to
Vaccinated
unload
doesn't
at any
mean
moment.
you're
Anybody could be
free
spreading
and
diseases, especially things like polio and pertussis that are not completely covered
to carry.
by the vaccine.
I'd do anything to keep my child safe.
That's any parent though. That's well, not any. Good parents protect the child.
I agree. I don't have kids, but when I think about it, the idea with vaccines is you're protecting all of us. You're protecting the group. There's this idea of herd immunity. And so I think that's why it's really important to talk about, because...
Stick a pin. When you come on to kids now, I think kids' immune system is way more weaker. It's not developed fully yet to the point where it can defend itself. So I do believe kids must be treated different from adults. An adult can do what they want, but a kid must be vaccinated. And also, don't slam the door. And also, I just wanted to talk because, what was I saying? Oh yeah, their immune system is not totally built up yet. So for them to fight off anything infectious. But as they grow older, it gets stronger. Or if you give them naturally made bush things, like, even if I tell you the names of them, people will know them because what herbs basically. Yeah, and it's an African thing because before they demonized Africa and called bush doctors, they vilify bush doctors in Africa after it was colonized, because that in Africa we didn't use Western medicine. It was all from the forest, bush doctors, and then, so they vilify them and they cut them out. So up to today, bush doctors are looked upon as evil. Continue before I drift off into that conversation.
This is an issue that doesn't just affect you, it affects everyone around you. Because there's people that aren't vaccinated that are sick or have immune issues, or they're too young to get a vaccine, and they count on herd immunity.
I think most people too, I started out vaccinating my daughter because I believed all the same things that you said. It wasn't until she had a reaction and several reactions that I actually had to look at it differently, where I realized by continuing vaccinating for her, that actually would hurt her. And yet everyone wants me to do it for the population, as if I'm supposed to continue to sacrifice my child for everyone else.
Well, I mean, there are medical exemptions for vaccines. If your child has a reaction and there's concern, I think that's valid. But I think a larger population is using other justifications to not get the vaccines.
A number of families who look into vaccines, they'll decide to opt out of vaccines because they feel they are just not willing to risk the side effects.
But the side effects are
And that's me.
like 1 in a million.
Stick a pin. But you can't say 1 in a million. Well, he can tell because more people don't see the side effect than majority of people don't get side effects. So he's true on that. But me personally, I get side effects from medications. I don't do medications. I rather, as I tell you, I go old school, back to the foundation, back to the African roots, and use bush for most of my whatever issue I have. I rather use bush than go over the counter medication. I got our pharmacies in general. That's why I don't even have a first aid kit. Not a first aid kit. I don't have a medicine cabinet because I don't do meds.
1 in 2 million. Whereas the side effects from the diseases, when I see all these outbreaks and things like that, I'm going to choose vaccines every time.
And that's, I think, right there is the disservice to this conversation, because it is a risk-benefit analysis, and what's unfortunate is how downplayed those risks are. I only started investigating vaccines because I ended up with a kid with an autoimmune disorder. So what does that mean? And instead of finding answers, I found more questions. The 1 in a million is not a real number.
It's really not.
And so the more
It is
that
a real
that's put
number.
out, so people think that no, it's not. Not when you're talking about the different kind of reactions.
I think the number you're referring to is anaphylactic shock. The anaphylactic shock is, of course, extremely rare. Whereas when you look at seizures from the MMR vaccine are 1 in 3,000.
But again, this creates fear in parents.
We worry that you get that those on your side kind of downplay those.
So my daughter had seizures. Seizures for most people are considered kind of a big deal. You know, when it happens to you, that downplayed element of, well, it's not anaphylactic shock, it's just a seizure.
It's not downplay.
It's just a seizure. But seizures can be dangerous.
I don't think it's an
It's an exception.
I think it comes back to what we were
It's not
saying
the rule.
with risk-benefit analysis.
Yeah.
And I think the data is very clear that the benefits of giving vaccines by far outweigh the risks. So I don't think it's a question of downplaying the risks. They're there. But we also know that children were dying, and now they're not. And yes, there's side effects, but they're not as bad as what we had before vaccines.
Of course not. I don't see what the issue with
I
that.
don't always trust my doctor's opinion.
I agree. Get a second or third opinion. Best of 3.
Anytime anyone, whether it's a teacher, a friend, something I read online, my mom,
Stick up in. With that statement, I think as a lady is going to explain, but for me personally, in life in general, they don't just take one person's word for anything. A doctor, a lawyer, a teacher, a psychiatrist, or your friends, your parents. You take what they say, yes, but it's not a bad idea to get a second opinion or a third opinion. Because then they can weigh all of them and say which two come closest and then can measure the rules in any situation.
The doctor, anytime anyone tells me, oh, you should do this, especially if it has to do with their health.
My father is calling. Hey, he can't wait till I do the video.
I would be careful about saying it's that I don't trust my doctor, but that trust has been developed over time. And so I would say in the early years when my children were very young, when they would say, this is what we recommend, yes, of course there were times where I got a second opinion or did the research on my own and asked the questions. And I think that as parents, we have to do that.
Well, it's hard to trust someone
Every
who sees
parent
your
wants to
child
put their
for
child
10 minutes, twice a year. In the end, parents know their children best. And that little office visit where your pediatrician looks at your child, he does not know your child the way you know your child. So it's
stick up in. No, she wrong there. I disagree. You know your child, but you can't see you cannot see inside a child's body. You need tests to eliminate certain things. So you're saying that doctor don't, you know your child emotions and feelings and some of her thoughts or her personality, but that's not the doctor's job. The doctor's job is to come, do the tests, get the results, and give it to you. So that's nonsensical. It makes no sense.
It's really hard for whatever recommendation he's making to be really based and individualized for your kid. So if you were to come to your doctor and say, hey, my child's acting
She's
differently after
everything.
This well-visit appointment,
Obviously.
Something's wrong. You want them to trust that you have an established relationship and listen to you and hear you and understand that as a mother, just because you don't have the DR in front of your name, it doesn't make your opinion somehow less valuable.
It doesn't make it valuable either.
Like anyone, doctors are fallible and they don't know everything. And I think it's very important, like you were mentioning, to have a really strong doctor-patient relationship. I think that's really hard in today's 10-minute appointment age, it makes it really difficult. But like as a young doctor, I think there's a lot of distrust when it comes to physician recommendations. It sucks because, you spend decades training and learning, and your heart is in this place where you want to be of service to people, and then you're not trusted. But, to answer the question, you shouldn't just blindly trust anyone's opinion, your doctor or anyone's.
That's common sense.
Ironically, the doctors are the ones that,
I trust my physicians. My daughter has epilepsy, and in March she was also diagnosed with juvenile idiopathic arthritis. I went to the rheumatologist, and the rheumatologist said, I'm going to put her on methotrexate. And I looked at her, I'm like, methotrexate, that's a chemotherapeutic agent that, kids with cancer get. And she's like, yes, but we use it in a low dose, and it doesn't cause harmful side effects. You have to trust me. I said, okay.
I wouldn't.
And I trusted her. And
I wanted some
I'm
information.
so glad that I did. Before all this happened, she was a competitive gymnast. And she used to walk up and down the stairs like she was 90 years old. She couldn't hold a pencil in her hand. Now she's back on the bars, back on the beam, doing things which...
Stick up in. Well, you see, medicine works. But like I said, everything is a double-edged sword. It will work for some, it will not work for others. It can cure some, it will make some others worse. It doesn't matter of where you fall on the spectrum. You fall on the left or you fall on the right. Most people get help, majority of the time. But there's exceptions, and then people want to use the exceptions to disprove the general. But it doesn't work like that.
My wife and I never thought that she would do it again. So yes, do I trust my physicians? Yes. Do I question them?
Of
yes.
course.
I will say, look, can we do this for her? Can we do this instead? And yes, I can appreciate what you guys have said as far as people hearing you. And I think that's the biggest problem in medicine, is that time is short, clinicians aren't listening. And I think that as a pediatrician, one of the most important jobs that we have is to listen to parents. And I think that if any pediatrician isn't doing that, they're not doing their job.
Yeah, that makes
There's
sense.
too much hostility between the two sides.
I get into a lot of arguments during COVID. With people who don't want to vaccinate because I was.
I want us to be able to talk. I want us to be able to have relevant and educated conversations. And I think at the core of this conversation is what is at the core of humanity.
Stick up in before we should go any further. As I was saying with the question, I had a lot, in the first month or two, let's say the first 6 months of COVID, I get into a lot of arguments with people about vaccinated, because I was vaccinated from the beginning. And they said, oh, why taking vaccine? But it's my choice. I choose to. So why are you having a problem with my choice? And this is what was causing a lot of... And then if it's up and we'll stop answer people. Vaccinated? Yes. They start, I walk off, because I don't want to have that conversation, because it's too much of argument, and they acting as if during COVID, for some reason there's a lot of doctors. For some reason, everybody's no doctor. Everybody know what's best for you, what's good for you. So I just walk away. It was that simple for me.
And being a parent, which is that we all want to do right by our children, and we want to lead happy, healthy, and productive lives.
Yeah, I have no doubts in my mind of how I've come to my decision making on the subject, which has been tedious and thorough, to say the least. I did not expect to go down this path in my life, but I have people who won't be friends with me, who I've had death threats on social media.
Not a death threat,
I might not even be able to send my kids to school, depending on how
which I didn't care about
changes,
anyway.
because of the way I
You can't want to override my
it's
choice.
Insane
It doesn't
to
work
me
like
how
that.
hostile this has become, and it's not doing a service to research and science moving forward, and just the overall dialogues we have in our culture, whatever the subject.
What I think is lacking in this debate or conversation is really compassion from the pro-vax side, or pro-mandate side, I'll say. The people who refuse to acknowledge that vaccine reactions are happening, or that the things that happened to my daughter were connected, because maybe it was just a coincidence and I just needed something to pin it on. You are socially isolated. You can be isolated by your family. Isolated by the medical community, isolated by society as a whole.
Yeah, that's not
So you're
right. Because
unintelligent,
vaccine do affect some people
I wish there was
greatly.
just more compassion. That no, we don't want
Again,
to
it's
do
an
something
exception,
difficult.
not
We
the rule.
just want to be acknowledged. My daughter was a victim.
She's right. I agree with her on
And she's
this.
being punished.
When I signed up for this, there was a
Yeah.
little bit of trepidation coming into this because you do hear things in the media, about the people who are anti-vaccine and the way they respond to physicians.
That was like a
and
war.
It is a little bit scary. As physicians,
Everyone.
we care about people. There's compassion on the medical community side. We wouldn't do this if we didn't care. But again, I do have compassion for the families that have gone through issues with vaccines, and I have a great deal of compassion for the families that had children die from preventable diseases. There shouldn't be any hostility. There should be discussion. I mean, we can
I think they're finishing up now. So
that's how we evolve. That's how we get better.
Yeah, they're finishing up. Let me just give my final thoughts on this. Whatever decision you make sure it's a decision for you, not for people. Don't make people influence your decision. You get your meds if you want, or you do first thing you go and research them, see what makes it, what they put in it, see the what are the side effects, and if it will affect you, and then you try it out first, and then if it works for you, it works. Me personally, I'm not so into medication. It's a personal choice because again, I get affected by it. So don't listen to people. Do what you want. Choose your choice. And if someone gonna argue with you about it, just walk away. It's that simple. Just walk away. You don't have time to be arguing with nobody about anything. You don't know what it is. It's the Washington XXM podcast. Don't forget to like, share, comment, and subscribe. Don't know. Peace. One love. Boom.